Hello, welcome everybody to another event within the UNIDO webinar series on quality and standards in the fight against COVID-19. My name is Dorina Nati and I'm here with 6 very renowned panelists. For all of those who have missed our previous sessions, we're pleased to announce that the recordings of all the previous webinars are now available online. For more information, please go to Trade, Investment and Innovation Knowledge Hub and follow the link tii.unido.org. As you can see, we already had a number of very interesting panels with very interesting speakers. So if you think that they're interesting, then please go to the website and have a look at the recordings, which are now available for everybody. Having said that, today's session will focus on personal protective equipment, a topic that has become particularly relevant in the past couple of weeks. Today, we will discuss the challenges related to standardization and how we can overcome those challenges in view of global availability and supply. Thank you all for being here with us today. We have 6 panelists and the session will be moderated by Mr. Bernardo Calzadilla-Sarmiento, who will also be giving some introductory remarks at the beginning. We will then follow with the panel discussion, where the panelists will have the possibility to give their insights, and we will conclude with a Q&A session. For the question and answers for all the attendees that would like to pose a question, please do so by entering your question in writing at the Q&A box at the bottom of your Zoom window. We will have a look and filter all the questions that come in. Unfortunately, due to time constraints, we might not be able to answer all your questions. We want to apologize in advance if this is the case. However, we will do our best to select the most relevant questions and ask them to the panelists after the panel discussion. I also want to say that today we're making full use of the technology available. So the session will be recorded and the recordings and the slides will be made available after the session. Again, for that, please always refer to the TII Knowledge Hub, tii.unido.org. And having said that, from my side, I would like to hand over to Mr. Bernardo Calzadilla-Sarmiento, the Director of the Department of Trade, Investment and Innovation at the United Nations Industrial Development Organization. Bernardo, the floor is yours.
Thank you so much. Can you hear me well?
Yes.
Yes, thank you. So we are so happy to have this second virtual panel discussion that was organized in the framework of our work on quality and standards. But before we go to our discussion, I would really sincerely thank the availability of our panelists today that are here today. We have colleagues from all over the world, from Canada on the one side of the world to China. We are in Europe, in Geneva, in Brussels, and also in Cote d'Ivoire, in Abidjan. So we have a widespread panelists being located all over. So let me briefly introduce our panelists. Dr. Mr. Ji Liu, he's Professor Associate in Beijing Municipal Institute of Labor Protection and has been working for many years in relation to standardization of personal protective equipment, including protective clothing, respirators, and has served as a member of the Chinese National Technical Committee. So very much into what we want to bring this conversation through. Thank you very much, Adriana. Ms. Adriana Velasquez is joining us. Thank you for making available your time. We know you are very busy these days. Joining us also from the WHO, I think you are in Geneva, and you are working at the Health Product Policy and Standards Department, Access to Medicines and Health Products Division, and you have been working more than 30 years in biomedical engineering and also working with vitro diagnostics at WHO, and also coordinating medical devices, technical series application Adriana has a background in biomedical engineering and clinical engineering postgraduate studies. Has been also very much engaged in the National Center of Health Technology Excellence and Tech at the Ministry of Health in Mexico, where she was the Director General. We have with her, Ms. Yingding from WTO, who will stay with us for the duration of the panel. Thank you very much. You are joining us from Canada, I understand, from East Canada. Thanks a lot. And you are a biomedical engineer from the University of Toronto, specializing in human factors and expert decision support systems. And you have been very active in providing technical specification, working in developing guides, especially during the Ebola outbreak. Thank you so much for being with us today. Ms. Silvia Vaccaro, Policy Officer at the European Union, has a background on engineering from the Politecnico di Milano and master degree in international relations. I remember the times we met at FEN, and I was with ICE, but long collaboration with UNIDO. Thanks so much to being with us today. I know that through the UNEC we have been collaborating also very much together. Lorencia Yahya, and I just say Lorencia, thank you for being with us. We have also been working together for many years in your capacity as Secretary of the Regulatory Cooperation and Standardization Working Group, working party number 6 at the UNEC. And you have been, as a matter of fact, spearheading this excellent work on gender responsive standards initiative, the declaration that is really trying to push forward the implementation of SDG 5. But also we have several other axes of collaboration, especially in risk management, also in other area where that is very relevant today. And finally, would like to introduce our colleague, Mr. Marcel Wabidi. Bonjour, Marcel. He is the Director General of the West African Accreditation System. He's from Senegal, but living in Abidjan. And he is specialized in international trade, quality management. He is a laboratory expert and has been working also with WHO, with French Development Agency, UNIDO, ITC, and he has been accompanying for many years the implementation of the West African Quality Infrastructure Development Program. So having then introduced the speakers, let me approach to the topic. I think like many of the audience and myself, we heard this word PPE only during the outbreak of COVID-19. And for me, personal protective equipment coming from Bolivia, coming from a country with a strong mining industry, protection was always the helmet. And now we see we are talking about a different protective equipment. It's gloves, it's masks, it's a glove, and also protection for the body. And all this has suddenly entered our jargon. It is day by day that we read it in the press, and it has become so prominent. It has become so prominent from day one of the outbreak. It has become prominent because of this big problem, which is the lack of matching of the demand that has grown exponentially from one day to another, and the capacity to supply. And I think that what is interesting is that we have been confronted with a lot of information, with figures, also with a lot of information about what is going on, flights going all over the world, trying to bring these goods to the countries. And we have been certainly looking at the importance of how to meet the supply, but also how to meet the quality and the standards. So let's look at some figures.
Yes, let's look at some figures. Well, what we have prepared for you today are some questions on the relevance and the magnitude of the use of PPE these days. PPE is an abbreviation which I personally have hardly used before the times of COVID. So it is something new to all of us. And what we have prepared a short poll for you. You will soon see a question on your screen and you will be able to click on the correct answer or what you think is the correct answer. Please, there is no right or wrong. This is rather for you to give a guess and for us to get an idea of the magnitude or how about the use of PPE these days. So the first question for you is, on average, how many examination gloves have been used per month since the outbreak of COVID-19? Is it 10 million, 23 million, 58 million, 76 million, or 90 million? Please, you will be able to click on the correct answer or whatever you think is the correct answer. I'll give you, let's say, 15 more seconds to do so. I see the answers are coming in. It's very interesting. So please participate in the poll. It's only fun if everybody does it. Good, very good. 5 more seconds. And I will end the poll now. Good, very interesting. I will show you the results of the poll. So most of you think it is 90 million. Actually, the monthly use of examination gloves per month, this figure is per month, is 76 million. So 76 million gloves have been used every month since the outbreak of COVID-19 on average, and the figure is worldwide. But your guess is not bad. We have another question for you. So let's continue. The question is, how many surgical face masks will be required until the end of 2020? So what do you think? You will be able to give your votes now. I will give you 20 seconds to do so. So you have a little bit of time to think, but don't think too much. This is for us to get an idea. Certainly the use of surgical masks has increased tremendously, particularly as many countries are requiring the use of surgical masks or of face masks in public spaces. So I'll give you 5 more seconds, but I think most of you have made up their mind yet. So I will end the poll now. Your guess again is very high, 6 billion. That's a tremendously high figure. Actually, the estimate is 2.2 billion face masks until the end of the year 2020. So we have one more, which will be, sorry, here you can see the results of the survey. So 40% think it's 6 billion and 24%, 29 of you have chosen the correct answer, which is 2.2 billion. And we have one last question for you, which relates to the increase in production. So to meet the rising global demand of PPE around the world, what do you think? How much will the manufacturing need to increase in percent? Is it 10, 20, 30, 40, or 50? I will again give you a couple of seconds to reply. 15 more seconds. Please put your answer by clicking on it. I'll give you a little bit more time. 5 seconds from now. All right, I end the poll and these are the results. The correct answer is 40%. It is estimated that manufacturing will have to increase by 40% for PPE. These are, so what I can see from your from your answers is that you already are aware that certainly there will be an increased demand and we will have to produce and use much more PPE. And this is precisely one of the reasons we're having the discussion today. We think it's a very relevant topic. Thank you all for giving your guesses to our poll. And with that, I hand over to Bernardo, who will introduce the topic in more detail. Bernardo? Bernardo, we cannot hear you.
Thank you very much. I think this was very interesting. And this only shows that demand and the need go into astronomical figures. I really don't know what figures to believe. I was reading in The Economist that it will depend also how do you measure. If you follow the UK regulation, they were saying you need to change the gloves after each patient. So this will be another size you will get. Each time we read about these figures, we have these 89 million medical masks that are required, 76 billion of gloves per month, or 1.6 million goggles per month. There will be a dramatic increase, this is no doubt. And what is also very clear is that we will have and maintain these astronomical, I call them astronomical figures that in which we are confronted. But in this, we have witnessed this match of demand and supply. And what is important to see is that the glue to bring together the demand to the supply is also the quality, because in whatever we have been reading also in the press, which I would say we have some facts, some figures, but there was also a lot of fake news, is that we need to look also into quality. And quality is fundamental to make this trade happen. And this is what we want to talk today, is how standardization, conformity assessment, and compliance with those are helping to meet this demand. But also what is important is to see how we can be sure that this will help. So today we are going to basically look at, next slide please, how to ensure that PPP is safe. And I would really like to bring you to more concrete qualitative type of thinking, which is the characteristics of these PPEs, which is related now to fluid resistance, leak protection, filtering capacity. So these are very concrete characteristics which have to be looked at, and we will certainly hearing more during the discussion. But before we enter the more technical part of our discussion, I would like to leave the floor for the first round to our panelists and ask them all the same questions. What would be from their perspective, what they have learned, what they have observed in terms of the challenges in relation to quality, to standards, to conformity assessment, that will help them to have all these PPE products available in the context. What did we learn in the context of this COVID-19 pandemic? So with that, I would like the floor, give the floor to Mr. Liu. Mr. Liu, please.
Hello, everyone. Yeah. Hi, can you hear me?
Yes, excellent.
Oh, okay. From my point of view, I think that if we want to ensure the quantity and availability of PPE products in response to the COVID-19 pandemic, we first have to promote the acceptance of PPEs that we have to accept them based on their performances. In my own experiences, that during our Chinese early stage of the coronavirus crisis, we don't have enough medical face masks. So, but we have examined products such as face masks that it was used for the industrial, which means that we can they are used for the coal miners, for the painters, and for other for others that were used And as because they have adequate protectability against particles that have the similar size or even smaller size than the coronavirus, they can be used to protect against such diseases, such viruses. And the second part, I think, is to facilitate the international trade of PPEs, because you know that during the early stage of the breakout of the disease, China have purchased PPEs and also received a lot of donations from other countries. Although not all of these PPEs meet the requirements of our standard of medical face masks, but they help a lot they help us a lot to protect our nurses, doctors to fight against such crisis. So yeah, this basically my 2 points of how we can deal with such a crisis during the COVID-19 pandemic.
Thank you so much, and certainly for us, it's very interesting to learn from your experience in China. Let me move on and give the floor to Adriana. Adriana, thanks for joining. We know you are very, very busy, and we are very keen to listen to you. What's the takeaway from your side? The floor is yours.
Thank you very much, Bernardo, and thank you on the invitation of UNIDO to be with you today. So Ying and I are very happy to be here. Well, I think the main issue that we have to concern is that PPE, exactly as you say, Bernardo, it was used for industrial. So it is basically the protective equipment was used for the industry, like the chemical industry, construction industry, other industries. And so a little niche was for health. Of course, the masks, that is like the first medical device that has ever been, because masks are used since 100 years ago. But now we have to change from being industrial to really have our main concerns on the quality, safety, effectiveness, appropriateness, affordability also, and even acceptability by the users in the health sector. And then in the health sector, we have like 3 big areas. One is the healthcare worker. We need to protect our healthcare workers so that they don't get infected, so that they can take care of more patients. But now we also, in this COVID situation, and it happened when it was in SARS, and then it happened in Ebola also, but now when there are these respiratory diseases, then the main issue of contamination is through the mouth and nose. So then we have to protect patients, but we have to protect the community. So now it seems that everybody's now having to wear a mask. It is not just the healthcare workers, but also the community and the patients to protect, and they do not contaminate the others. So even though now we're wearing the masks, the face shields, now there is a lot of innovations, and maybe we can have a reuse of them and reusable products. But the main thing that is really worrisome is that most of these standards were made considering the industrial part, not really the biochemical part and chemistry and pharmaceutical. But now we really have to face on the part of the medical and healthcare workers. The second issue that is very important is most of the people that decide and make these standards are not having a worldwide representation. It is mostly high-income countries, mostly the industry that is doing the standards. So how can we really encourage other voices to be able to provide information about how standards should be made and the certification, the standards of the products. So I think we are in a difficult situation. WHO has been producing standards and regulations and standards for pharmaceuticals, for vaccines, but not really for medical devices, not really for protective equipment. So now this is a very important area in which we have to participate as WHO, and we are providing technical specifications, and we are working with the industry now, with international organizations. So we're very happy to have the possibility of work with UNIDO to make sure that whatever is either locally produced or give guidance to local production, and also for the production globally, that we could have better standards and quality assurance and verification and testing for all these what we call medical devices. No, so thank you very much.
Adriana, indeed, we have a lot of work to do together. Thank you so much. And for us also, we know very much WHO from the food safety area, from the good laboratory practice, but this is also a new area where we at UNIDO feel that we can contribute. We have been collaborating with WHO for many years in relation to local pharmaceutical production. So we have a long history. We have been contributing through the codex. We have been converging. So we have a number of entry points where we have been collaborating. But as I said at the beginning, I think we are facing here a new situation. Not that only COVID would lead us to this new normal, but we will really go to a new situation. And I very much appreciate your sensitivity about how can we ensure that developing countries take part in the standard setting, because yes, the high end for the technological medical products, we have good standards and we have many good standardization bodies, but what we need is to think for the communities and all this. So thanks so much for your insight. And I know you will leave us, but your colleague Yin Lin will continue the discussion with us. Thank you so much, Adriana, and we will keep in touch.
Thank you very much.
Okay, thank you.
He will continue. Looking forward to working with all of you. Thank you.
Let's continue with Sylvia. Sylvia, EU has from the outset become very prominent because we have heard a number of policy decisions. The most positive was that immediately you freed, you worked, I think, together with Sensenelec to get the standards for free, but there is much more behind. So please tell us your take.
You're muted. Sorry, I forgot to unmute myself. I was saying that I will give more details in my presentation later on, but I think we can have three main conclusions out of this crisis. The first one is that no one was adequately prepared, nowhere in the world. The second one is that the world is now a place that's really interconnected. So something that starts in one side of the world within 3 weeks goes on the other side, and there's no way to stop it. And what we saw in the EU, first of all, the European Commission does not have any competence in terms of health. So the health is still a competence of the member states. And what we noticed as soon as the crisis began was that all the member states, sort of as a knee-jerk reaction, tried to protect their own. They didn't think about the union, they didn't think about anything else, they just thought about their own country. And of course, this created some problems within the internal market. So our first task, actually, was really my directorate, was to try to keep the free movement of goods flowing, especially for goods that were important for the crisis. And for that, we created some green corridors to allow the exchange of merchandise from one member state to the other. And I must say, this is working very well. And also a lesson that we should probably learn is that the moment that the European Union started sort of centralizing all the requests for PPE for purchase, of course the conditions became better, and it was also more easier for member states to get what they needed. So again, well above my pay grade, but maybe one lesson will be to see if also for health issues there should be a movement towards a more community-based approach rather than the national approach. But as I said, well above my pay grade, so I'm not speculating on this. Another thing I wanted to point out is that what we call PPE in Europe is actually PPE, medical devices, in vitro. So they're all covered by a little bit different things. And actually the standards that were made available for free, and I will discuss it a little bit more later, were actually on PPE, but also mostly on medical devices. So in Europe, basically, personal protective equipment is for everyone. And especially in this case, all the FFP protection masks are covered by the PPE, as are the worker wear protections and other things that are not particularly used only in hospital. While on the other hand, we have medical devices, and these are really only to be used in a medical context, including, for example, surgical masks, medical gloves, intensive care, and other equipment that is used only for in a hospital context.
Thank you. Thank you. Thank you very much for this remark, Silvia. And let's move on listening to our other panelists. Lorenza, we give you the floor.
Thank you. Thank you very much for organizing this webinar series and for the invitation. I would like to make two broad points now in the introduction. The first one is about information, and the second one is about cooperation. And as regards information, I think we've witnessed how much it is important to give firms and also administrations access to information on the relevant guidelines for them to adapt their production facilities and for them to ramp up production to meet the demand that we have before us. So firms, administration need access to standards. They also need access to information that helps them identify which are the right standards. And that's something that I find is a really good example of why standards matter for the Sustainable Development Goals. And in particular here, of course, we're talking about SDG 3, so health. And, but the same is true for all of the SDGs. Without standards, we cannot achieve any of the 17 SDGs. And that's why our organization, UNECE, has built a portal, which is called Standards for the SDGs, which allows the identification of standards that allow the achievement of the goals and targets of Agenda 2030. And the second point I wanted to make is about cooperation. And I'm sure we will touch this point also later on. But here it is so important for countries to continue, and Silvia referred to this at the European level, but it's really global. We need to continue to work together. One concrete example, and I think that the standards world, as always, has been so generous and so cooperative. And we would like to see the same in other areas of the world, the same cooperation and harmonization spirit. But just to give you a couple examples here, I read that the Spanish Ministry of Industry has allowed to access on the market products that do not just comply with harmonized standards, but also products that comply with American standards, with Chinese standards, with standards from Australia, Canada, Japan, and finally has even given discretion to the accreditation body for allowing on the market other products from even more jurisdiction. So this is the kind of cooperation we'd like to see. And as well, the same was in the United States, where we saw the same, the approval of use of respirators that were conforming to different standards, including Chinese standards, for example, as well as European standards. So I think I'll stop here and look forward to discussing further with colleagues. Thank you again.
Thank you, Lorenza. Indeed, the cooperation and the SDGs is of big concern. I think the COVID is setting back our drive to achieve the SDGs in a way nobody could have imagined. We will not touch today about the whole economic implication, the disruption of the value chains, it's all what it means that we will need to invest in recovery. It will be tremendous. But still, I agree with you that we still have this framework, the development framework, the sustainable development framework that can help us to guide and continue guiding our joint actions. Thank you so much, Lorenza. And with that, I move to Marcel. Marcel, we need to hear the voice of Africa. We need to hear what is coming from your side of the world, but also as the head and the director general of the accreditation body, SOAC, we also would like to hear more of one specific element, which is conformity assessment.
Thank you so much, Bernardo, for the invitation and for this very interesting webinar. I think that from my point of view, I would like to stress the fact that because of the shortage of the demand of the PPEs, and specifically of masks, we have noticed that we have a new need of local tailors, of handcraft tailors, specifically in West Africa, because you know that it is quite difficult now to be able to have PPEs coming from abroad. So it means that in Africa, we need to find new way to train our local industry and all these very small enterprises. And I think that by the past, we have some very supportive program to support these very small companies. But because of this pandemic, it's very more important now to be able to rely on these specific very small companies, and this is very challenging. So it means that we need cooperation in training, we need cooperation with all the international companies, but at the same time, we need to be able to have a good level of training for these people. Some of them are not so well educated, I will say. So it means that how Africa should take into account the fact that now we need to rely on our local industry. The second point is the fact that we see that now the quality and infrastructure, specifically in West Africa, is very important, because by the past, we were working on the laboratory policy and so on, and we need that. It was not so known by the authorities, but now with this pandemic, you see that in the ministries, in the private sector, everybody is interested in quality, and I think that it is very good for the promotion of quality infrastructure and the promotion of conformity assessment mechanism. So I think that with the cooperation that have been developed between the countries and the region, it's allowed now to have a better understanding of the needs of all these support to the conformity assessment. And this is the two big points. But I think that in my presentation, I can go ahead and give more explanation of the challenge that yes.
Thank you, Marcel. And you're touching also on this very important element, which is cooperation eventually more at the regional level. But it seems that this is a very, very key element for moving forward. And yes, I see that we are already moving into the next phase. I would like to ask Mr. Liu if he can give us a picture on what are the common denominator of those main divergences in PPE standards between the three main producers. I think Lorenza made reference about that, but also Adriana about the different divergence of standards at the regional, local, international level, but also from different standardization bodies. ASTM has very famous bodies, ISO, Sentinelec. So please, what's your take on this issue of the different type of standards? The floor is yours, Mr. Liu.
Yeah, I think maybe next page will be next list, please. Yeah. So you say that in the can you hear me?
Sure.
Okay. So you say that so you say that on the right there's a table which was given by our national health committee to guide to guide the citizens on how to use the PPEs to protect ourselves against the coronavirus. And we can see that from the up to the bottom, there's lower risk levels, which means that on the highest on the high of the table, the risk is quite high, which including the surgicals and doing the cut of the throat. And at the lower part of this table, there's quite a low risk scenarios, which including just walking around in your committees and also go to school or go to the buses. And from the left to right, there's the corresponding face masks that can be used to give us suffice protect abilities against the risk at such levels. We can see that as a high risk, we have to use face masks that provide us with higher higher performances, and at scenarios with very low risk, we even don't have to wear the face masks. So first and so this is first a little guidance, so that as we know that we are on a world shortage of such face masks. So if we can divide scenarios and choose different face masks according to the scenario, we may save a lot of productivities, so that we can keep better materials for the higher level of face masks used that we can supply them to the doctors or the nurses or the medicals that works at high risk areas. And the next slide. The next page, please. Yeah. So first, to introduce the standards, there may be some technical concepts. Here I divided the requirements of the technical requirements of face mask into 4 categories. First and most important is the protective properties, which including the filtering efficiency and the total inward leakage and the splash resistance. And the second part is material safety, which defines that we have to make sure that the material that was used to construct the face masks would not bring any harm to the wearers. And the third part is the comfort, which mainly about the breathing resistance. The breathing resistance is the addictive burden that introduced by the mask to our breathing processes. The higher breathing resistance is, the more difficult we will breathe when we using the face mask. And the last part is the other requirements, including the marking and the information supplied by the suppliers. Basically, all the product standards referring to the face mask can be divided into the technical requirements of a product standard can be divided into these 4 categories. And to better illustrate the to better comparing the standards, I use a triangle map to show what different kind of products can be shown. So the next slide, please. Next page. Yeah. The first and this page demonstrates the okay. Maybe you should refer to the last, so that we can remove the figure. The backward, yeah, okay. So basically here I demonstrate 2 standards. One is GB 1906 83, which is the technical requirements of protective face masks for medical use. That is what we use for the nurses or the medical workers at high risk scenarios. And the other part is EN 149, which is quite familiar, which Miss Celia may quite familiar because it's a face mask product standard for the industrial. It is respirator protected devices filtering half mask to protect against particles. And below is a table that I comparing the performance levels of these two standards. We can see that they all almost have an identical performance. First, from the filtering efficiency, we can see that the GB standard, the filtering efficiency should be higher than 95%. And for the EN standard, we get an filter efficiency of about from 80% to 99%. Okay, from the fitness factors that was used to describe the inward leakage when wearing the face mask, we can see that they almost the GB standard is a little bit higher than the face mask than the EN standard, and there are other technical requirements including the material safety and the comfort. And at the bottom there's a triangle map showing that the basic performance levels, which it has 3 dimensions, including the protection, the comfort, and the safety. The protection is quite good because the full score may be about 1.0, and they have the performance about 0.8. And from the comfort level, they are a little bit lower, from 0.6 to 0.8. And then we can go to the next slide. Next page. Yeah, this slide showing the comparison of 2 standards, including the EN 14618-3, the medical face masks requirements and technical methods. That was EN standards that were used to describe that was used to regulate the face mask used for medical, and also we have the YY standards, that is a medical standard used in our country for the surgical mask. And by comparing this, we can say that first, the 2 products have filtering efficiency and bacterial filtration efficiency. We have to emphasize here that the bacterial filtering efficiency, according to our test and according to the samples that we have gathered in China, they are quite related. That we always have filtering efficiency number. That is, if we have a quite good filtering efficiency, we could definitely have quite well bacterial filtration efficiency. And after that is material safety and comfort. We can say that this kind of face masks may have quite good comfort, but as we mentioned about the protection performances, is a little bit lower than that of the previous kind of products, which is coordinated to our government guidelines for the selection of the face masks. For the selection of face masks used at higher risk levels. And the next slide, please. Okay, there's just a demonstration of this. And here's another kind of product that were used for the highest risk levels. And that is full face masks and half and quarter face masks. we have to say that they have best protective properties, which can be seen by the number of the inward leakage. For the full face mask, its number is 0.05%. And for the half and quarter face mask, is lower. The number is a little bit larger. That is 2%. When calculated by each of the individual wearers at the mean average of the inward leakage. And on the right is a triangular map of this of this kind of product, which means that it has a highest protection level and a little bit lower safety. So by comparing these three categories of products, we can see that they have different names. For example, the industrial respirators, for the medical face masks, and for the half and half quarter or the full face mask used at other scenarios, but they have similar technical requirements called when we say that we have to test their filter efficiency, the total inward leakage, or the fitness factors, or we have to evaluate their practical performances. We have to check that if they have skin irritation or the skin irritation or the virtual or the cleanness of this. So we have to say that they have different names, or maybe they were first designed to serve different purpose. But we have to say that as long as if we evaluate their protective properties, and by their testing method, we have to say that they are quite common for use to protect against the coronavirus. That you can use industrial face mask to serve the purpose, and you can also use medical face masks. Yeah. So that's I think that's all of my presentation. Thank you.
Thank you so much, Dr. Liu. This was very interesting, especially showing for the medical devices, the standards that are used, and while there are differences, how elaborated these standards are. In the meantime, I was distracted also looking at the Q&As, and I see that a lot of questions from the participants are more worried about the daily user and community that is going on there. We will get back to the questions later.
Okay.
Thank you so much. We will listen to Ms. Ying Ding from the WHO, and she will also from that angle provide us, and I hope, an idea what is the contribution from WHO in standards harmonization in addressing regulatory issues. So with that, Ms. Ying Ding, the floor is yours.
Okay. Hi, everybody. Can everyone hear me well?
Yes.
Okay, I see nodding. Okay, thank you very much. Thank you for your time and the invitation to participate in this webinar. So I'll give the perspective of the operations support and logistics challenges experienced with PPE procurement as it relates to standards and regulatory clearances, as well as how the WHO has been contributing to kind of solving in this pandemic situation those challenges. So we'll just go to the next slide, please. As discussed, and the setting for all this is really the issue with the large volume procurement that we're facing, and also the competition for that limited global supply. One of the challenges that we've noticed is that there's no global regulatory body for these items. And as a repercussion of this is that there's no post-market surveillance. These exist, of course, in countries and regions that can easily recall when there's a defect, or manufacturers can push notifications to alarm, I guess, issues with detected failures of PPE in the supply chain. And so this has been a real issue for us because WHO is procuring for several UN agencies as well as ministries of health, where it's just more difficult for other countries to access this limited supply. So that's a real challenge right now. There's also, as Professor Liu very clearly demonstrated, that there is differences in the PPE standards. So they're linked to the regions. We would like that ISO would have like a single standard to guide us. But really, there are some test methods that are sometimes referenced, but not consistently across those regional and national standards. So we've had to take shortcuts, and for our checks on performance of potentially procured PPE, we select the most relevant standards and boil it down to what Professor Liu was showing as being more of the common tests that can be applied across similar items such as respirators or masks, and just trying to get some consistency in our global supply. There's also issues with Class 1 medical devices. In some jurisdictions, these are self-certifying, self-labeling. This means that there's less oversight. Because it's self-certifying, we have to kind of assume in some cases there's a robust QMS system, but sometimes that's not necessary for the Class 1 medical devices, and maybe that's something to discuss in this forum. There's also some low-cost PPE items such as disposable aprons, even the heavy-duty aprons, and disposable face shields that are not quite meeting any specific standard just because they're disposable, but these are the ones that we're trying to procure just because in the pandemic situation, that's what's most easily produced. And we also have issues with the certificates that we receive. Sometimes they're not full test reports, sometimes they're low quality resolution, and of course they're tied to those region-specific regulatory bodies. And we also are encountering supplies from new factories which have not had experience with PPE. They might have produced electrical equipment and are producing new PPE because they have access to the plastics and raw materials that can make them. And they may still produce high quality products, but we must test prior to accepting. So we've had to do a lot of the work that usually established manufacturers have already done themselves if they have been producing for several years. And we rely very much on third-party testing capacity. We have preferred labs through which we have very good test reports, but this is also a limited resource just because we know that our preferred labs are overloaded. They're now switching from 8-hour lab testing to 24-hour cycles. So they're switching that to like 3 8-hour shifts, and they also still have a backlog. So those are some of the challenges we've encountered with PPE procurement in this context. Next slide, please. So in meeting kind of a ad hoc standardization or harmonization of the standards, we actively update the disease commodity package for COVID-19. There's a technical description in words because sometimes, for example, an item may pass the test, but other metrics such as comfort, let's say, it's not a measured metric that's included in the standard. So we know that there's water vapor transmission, other standards that are test methods, let's say, that are defined, but they're not included in the parent standard. And this is what we've encountered with Ebola as well. So for coveralls, much of the issues with coveralls when they were sent to West Africa was that it's high humid, high temperature conditions. So it was very important to have a balance between permeability or fluid resistance and breathability. So we asked for one of the metrics to be included, but it's outside of the standard. And so this is where we need to balance and really understand what technical standard test methods are available and how we can ensure that finally the end user will be able to use this comfortably and without danger to their during their shift. So for example, because breathability was not built in, the very impermeable coveralls were used in the field and clinicians were fainting. So there's a need to really, as Adriana mentioned, really look at those PPE standards and see how they should be applied and modified for healthcare settings. And so in this DCP, we also reference standards and if possible, large regulatory bodies that usually clear many of the items. So that's another option. I think we are actively trying to find and understand equivalency in the standards. So we boil it down to the test methods and performance levels. And we also participate in rapid research projects to give evidence to the rational use of PPE. So for example, there's the demand study that's with 12 different agencies, including universities, for the decontamination of the high quality N95 and disposable masks made of non-woven materials, and which have very good breathability as well as filtration. And so we also regularly update other documents that help minimize the need or demand for the disposable traditional PPE items. Thank you. That's the end of my presentation. Thank you for your time.
Thank you so much for your insight, and really we can feel through the way you describe the working in the labs how challenging this period is for you at WHO. All the work that comes, but also the important role that you can play to help us to cope with this pandemic. And again, thank you, WHO, for joining us in this important discussion. We want to move to listen to what the EU will tell us. So, Sylvia, don't forget your mic. What efforts have you taken in the EU, and we discussed about that a little bit with respect to standards and conformity assessment, to market surveillance. How can this action at this moment also help to pass over the crisis so that the supply we get is fit for purpose in this world of the PPEs? Sylvia, please.
Yes, thank you very much. Well, as I said, I think I will give a very quick introduction. You can put the first slide if you want. Yes, that's the one. Basically, the first remarks that I would make is that quality infrastructure in the EU is something based on trust, on the responsibility of the manufacturers, and on market surveillance. So that means that we leave to the manufacturer the responsibility of his own product. But of course, we have working market surveillance, and in these circumstances, it has proven essential to have a well-functioning market surveillance and also a very good exchange between member states so that they could exchange information on products that were not safe enough. The second point is that standardization in Europe is based on public-private partnership. That means that we have a continuous dialogue with Sensa and Canezzi, and we support them, and in exchange they support us. One of the main feature of the standardization in Europe, especially when the standards are used in regulation, is in legislation, is that European standards are hardly ever mandatory. Everything is voluntary. So if the manufacturer decides to use another standard or another things to comply with the essential requirements of our legislation, it can do so. And in every legislation, there is a chapter describing if the manufacturer does not want to use what we call harmonized standards, which are European standards, often international, so ISO or IEC. And these standards, if they are used, they give presumption of conformity to the legislation. That means that the manufacturer knows that by using that standards, he comply with the European legislation. Of course, that's an easy way of compliance, but that doesn't imply that the manufacturer is obliged to do it. Then we had our big shock when COVID happened, and basically all the global supply chain was touched, and exceptional circumstances call for exceptional responses. So as I said, for quality infrastructure, we had to, as European Union, we had to intervene on a lot of different fronts. The first one was a free movement of goods that I touched briefly before. So basically, we negotiated with all the member states some sort of green corridors where the free movement of goods, and especially of goods that were essential to the COVID-19 crisis, were established. And one of the requirements was that there should be no more than quarter of an hour queue at the borders. And I must say this worked. It was one of the first weeks. I mean, in Belgium, we started teleworking on the 16th of March. And by the 23rd, basically this corridor were established, and they're still working very well. If you put on the next slide. Yes, basically, so we had a problem on quality, and we had a problem on standards. Let me start with the one that I know the least, which is the conformity assessment issues. Basically, we decided, I think mid of March, there was a communication of the European Commission and the Council, basically recommending to several things. One of the things was sorry. One of the things was to try to make it possible for personal protective equipment or medical devices equipment to be exchanged and within the European Union, but also trying to limit a bit the possibility of European countries to sell these PPEs abroad. So, for example, we recommended notified bodies to prioritize testing for PPE and medical devices for COVID-19 and publishing some guidelines for the conformity assessment. One of the main feature of the recommendation of the communication from the European Commission of March was to allow temporarily the circulation of PPEs and medical devices which are not necessarily CE marked and tested according to European standards, but we refer to the WHO recommendation and decided that if the market surveillance authorities in one member state decided that the non-conform masks are on the field, it would be allowed for them to circulate within the single market. And this was to sort of control, on one side, keep the control on what is distributed in the single market, while at the same time allowing for more PPEs to be circulated. You probably have read everywhere in the news that a lot of firms have reconverted to prepare and manufacture PPE. And to help them doing that, basically, one of the first things that we did was to check with CEN and CENELEC if some standards for wearable protective equipment could be made available for free. And I must say the response was pretty quick, and now you can download freely from the national standardization bodies' websites, because CEN and CENELEC do not sell standards, but the national standardization body do. So for I think it's a list of up to 15 different standards for the personal protective equipment and the medical devices one that are freely downloadable, mostly also in the national languages. And at the same time, we also try to push through, because to become a harmonized standard, so to give the presumption of conformity to European legislation, a standard has to be formally approved by the European Commission. And this, of course, is a process that can be lengthy. But in this case, we were incredibly fast. I think in 1 week or 10 days, everything was passed through. And so there was a new list of harmonized standards for medical devices, and their reference was published in the official journal. So now, for example, one of the things that is not there yet is that now in Europe we have a lot of, let's say, homemade reusable masks with a pocket for inserting a filter. And in this case, some member states have started preparing their own guidelines on how to make them. And now we would like to take this project at a European level, but this is still under negotiations with CEN and CENELEC. But I will say that this pandemic has really showed us the importance of cooperation between the different standardization body, between the different national administration, and also between the European Commission and all our stakeholders. And that's it. Thank you very much.
Thank you so much, Silvia, for the insight on what the EU has been doing. And I think very important is also what can come, especially for the smaller groups. Again, your presentation also shows that in the medical, higher technology end, there is a lot of standardization, but a lot of demand also to ensure safety from communities and people. And meeting the demand of the needs of people, of consumers, we have certainly the specific needs of women. And I think Lorenza wants to talk with us about that. She has been spearheading the gender initiative. So from your observation, Lorenza, why and how gender needs to be considered in standardization of PPE?
Thank you, Bernardo. So I'll go straight into it, and please show the next slide already. So my first point is that personal protective equipment, not just in the medical sector, but across all sectors, really penalizes women in many ways. First of all, poorly fitting PPE can lead to injuries. For example, police women lament that their vests do not fit and result in exposure to attacks. Wrong shoes, wrongly sized shoes or overalls can increase the chances of tripping, or ill-fitting gloves lead to problems in gripping, and that decreases the productivity. And it also strains employer-employee relationships, because women complain about, rightly so, of course, about these problems. And it may even lead to permanent bodily damage when it is in use for a long term, and even creating issues from ranging up to foot deformities. And I have taken these examples from a survey that was carried out by a trade union in the UK with more than 3,000 responders, which overall said that PPE sometimes or significantly hampered the work of 57% of the women responding. And in particular sectors, the percentage of poorly fitting PPE was a lot higher, rising up to 82%. Next slide. So now coming to the medical sector, the vast majority of workers in this sector are women. And according to an analysis of 104 countries by the WHO, there were about 70% of women on the front line. And these women lament that masks and shields are ill-adapted to the shape of their face, and that leads to a lack of adherence of the mask or the goggles to the contours, and it can lead to exposure to the virus. Gowns are often too big, and again there is a risk of tripping, or the gown can touch the floor, which may be wet and unsanitary. Then there is the complaint on use of overalls rather than trousers and blouse that makes women unable to take sanitary breaks. And overall, we have very little data on the impact that this has on women. But there is one data that I managed to find from Spain, where it says that the infection rates were significantly higher among women health workers than among men, with a percentage of 29% of women that had been contracted the virus versus 11% of men. Now, I think the fault is not all with the standards, it's also, in a sense, the poor sensitivity of the health industry to this issue. And this image that I put there kind of summarizes this. You know, you wouldn't put the extra small size up on the top of the shelf when the colleague who is smaller size will not be able to reach it. So what I mean with this picture is really to say that the issue is nuanced. So there is one issue with the standards, there is one issue also with the culture of the place itself. Next slide. I'll then want to call attention especially then to the standards. And if we look at the European standards, which are based on ISO standard, when you look, for example, here, the example is a standard on gowns. And all the figures that are reproduced in the standard are all male figures. There are very few female figures. And they're not in the minimal requirements, but they're in the other possibilities. So they're not as prominent. And that's particularly perplexing when you realize that 70% of the workers in this sector are women. So why is this not, at least at the same level as the male figures on these standards? And so I'll go quickly as I realize I'm already at the end of my 5 minutes. So next slide. And this is exactly the kind of issues that we have been tackling under the UNEC Gender Responsive Standards Initiative, which was set up in 2016, bringing together a very diverse group of stakeholders with the objective of integrating a gender lens in standards and standards development and strengthening the use of standards for SDG 5. The declaration that this initiative developed was opened just 1 year ago yesterday to signatories, and we already have almost 70 now, and these standards bodies are really from all sectors and from all countries, from all regions. So I think this is the last of my slides, and I'll stop here. Oh, there's one more. Well, I think we'll stop here for allowing a little bit more time for question and answers. Yes.
I appreciate so much, Lorenza. Thank you so much, and And yes, I think this COVID-19 crisis has shown the gender divide not only in the standardization world, but in the lockdown. We have heard so many challenges in the unemployment, in the households, and so much more. We could have a full discussion on the challenges, and a lot is going on in order to address this. But thank you for sharing from the perspective of standardization and PPEs what can also be done through the initiative to address these issues. And last but not least, we will move to Marcel from Senegal in Cote d'Ivoire to listen to the conformity assessment that is not existing probably in relation to PPEs. So the question is, how can a conformity assessment mechanism deployed quickly to respond to the new need? There is a new need. There was no conformity assessment. I imagine also not in the region, but I see from the questions also from the India region, we are hearing some questions around that. So how can we meet this need to ensure that the customers have more secure PPE, that we can build the necessary trust? Marcel, please don't forget your mic.
Thank you, Bernardo. Next slide, please. Okay, so I have listed in all the discussion. I think that conformity assessment body is a challenge for this pandemic. We have tried to notice two big situations. You have these countries, these developed countries, where you have a very strong conformity assessment mechanism. I mean, you have accreditation laboratories, accredited laboratories, accredited certification bodies and inspection. And also you have the AB, the accreditation body in place. So the AB should be a signatory of the international organization like ILAC and IIF. And also you have the situation B, where you have developing countries with an insufficient number of laboratories, inspection bodies and certification, a small number of accredited conformity assessment body, and sometimes you have no accreditation body, or the body is not yet recognized internationally. So this is a challenge for these countries, because at the end of the day, please next. Yeah, thank you. At the end of the day, what we would like to have is just that testing. I mean, the labs, the inspection bodies, and all the certification bodies should be accredited by accreditation bodies and rely on the international system, which is supervised by IIF and ILAC for the labs. So this is what we need to have at the end of the day to be sure that the end user can be safe when using all these PPEs. Please, next slide. So what we have noted during this pandemic is the fact that even if, whether it be the case A or the case B, as it was said previously, it was a challenge to allow the end user to have completely on PPEs because all of a sudden you have an explosion in demand for these PPEs, and how the conformity assessment mechanism can react to this situation. We have this discussion about the CE type. As you were saying, it is a responsibility of the producers, but since you can have business opportunities, sometimes we are not sure that we can rely on all the conformity assessment mechanism as it should be done on if it is not a situation of crisis. So in the case B, I mean, in the developing countries, it's quite the same, because of the fact that the mechanism is quite, the conformity assessment mechanism is quite young, you have a high risk to have at the end of the day non-compliant PPEs, specifically masks, to the end user. So how can we address this situation? Next slide, please. So I think that we have many possibilities, but I would like to highlight two of them. The first is the certification system. It could be voluntary or mandatory. But what is interesting with the certification is the fact that you can at least try to master the local producers. As you were saying, a lot of companies have shifted their activities to be able to work on the production of PPEs. And for example, here in West Africa, we are working hard on how to quickly help the local producers to be able to deploy quality management system based on international standards on PPEs, but for product certification. At least since it's quite difficult now to import these PPEs from abroad because of the shortage. So I think that this is one of the ways that can able to ensure that at the end of the day, the end user could have safe PPEs. Next slide, please. This second solution was developed mainly in developing countries because they were aware of the fact that they do not have a strong conformity assessment mechanism. So we have what we call the VOC, which is the verification of conformity. This is a pre-export verification carried out by strong inspection bodies which rely on a very strong network of accredited labs. And the purpose is that before you ship the goods, and specifically the PPEs and the masks to the countries, it should be tested before. And what we have as advantages is the fact that you will not have the banned goods in your countries. You will not have to supervise the cost for the destruction. And at the end of the day, you have a system to try to master what is coming from abroad in this pandemic. Next slide, please. So in conclusion, I will say that we can have these two approaches that are quite interesting. For example, here in West Africa, countries are working days and nights to put in place a certification system to be able to master the local suppliers. I was saying that we are relying on very artisan tailors and so on and so on. So it means that at least you need standards, you need to have a quality system in place. And concerning the abroad product, I have noticed that many countries have added the PPEs on the list of products that need to be to have this verification of conformity certificate. So at the end of the day, with these two approaches, you can have at least some good, some safe and compliant PPEs like masks that the end user can use. Thank you, Bernardo.
And thank you for all the panelists for sharing their views, and also for keeping the time that leads us to some minutes at least to have some questions. And one that is recurrent is more how this is affecting the population and the communities. And I hope Mr. Liu can help us to address this issue, because it's not so much on medical masks, but how long is it recommended to use a mask per day? I don't know if you would have some response to this question, Mr. Liu.
Sorry, this is quite a complicated questions, because different products have different recommended use of time. For the masks that we use for industrial use, let's say commonly they have a lifespan of about 8 hours. And for the surgical masks or the medical masks, they are just they should be disposed if you take them off. So quite different stories. And during our time of fighting against the coronavirus, I think that for the surgical mask or the medical mask, we basically use this for 6 hours. and from the resistance, the rising of the resistance, or the testing of the filter efficiency, we have to say that most of the medical mask can serve their duties, but I'm not sure for other products because it's quite material related property. So yeah, they have to follow the instruction of the manufacturers, not from the I say from me or from others. They have to get the information from their manufacturer. So yeah.
Another question that we receive is related to developing countries and how developing countries and their population can cope and guide their populations, because in many countries, also in Africa, many people started to produce the mask, but how to guide them to produce them in a proper manner. So eventually there is a need for guidance that can be provided. Would standards be the right tool to address this issue? Do you have some response to this important question, Marcel? What would be your take?
Thank you so much, Bernardo. I think this is a key issue, and presently we are working with the support of UNIDO in the ECOWAS region, because we need absolutely to have standards to address this issue. And what is being done is that we are, for example, for mask, the region is working on a standard that could be adopted at the level of the ECOWAS Commission, and to help the tailors locally to be able to produce the mask. What is also interesting is we need to have training, because I was saying that this is not very big companies, very small company. We have SMEs, very small companies, so they need to be guided. And it's why after the standard, we would like to have also leaflet, training tools, some short movies in the local language, so that we are sure that all these small producers can be able to be involved in the business of PPE's production, but at least with the respect of all these standards. Also, what is done is that we have tried to check what is the availability of labs in the region and the technology, so that we can at least be able to do some tests, a minimum test, to be sure that the product is fine for the end users. So I think that we have many challenges, and one of the issue is to rely on standardization with all the member states, but also using the cooperation that we have.
Thank you very much. And I have two questions here that are looking more into the future, and then the easier one is basically related to the EU policy and what will happen after. Will it be maintained? How do you see moving into the future in terms of standardization? How long will these policies of freeing be giving the standards for free, supporting production will last? Is there a lessons that we can see into the future? And just to early one, the other question relates also to the future. What role can take the WHO, in terms of standardization? Will they take a lead? Is there a role to take the lead? So a bit, I think, related question, how we can forge cooperation in this regard in harmonization in the future.
Well, as you know, standards are copyrighted material, so we are very grateful to the standardization body that gave us their availability to lose some income in order for the common goods. But I would see some sort of mechanism to face pandemics and face crises like the COVID-19 in the future, for sure. So this time we had to start from scratches. So we will definitely probably have a talk with Sensenelec and ETSI and see if this kind of a response could be triggered in a quicker way without having to go back to negotiations like we did this time. However, I also am a firm believer of the business model that the standardization body have. So if their liability depends on the sale of standards, obviously we cannot take that away unless we modify the business model. For example, in Europe, ETSI, which is the ICT standardization body, its deliverables are all free, but of course there is a price to pay for participating to the standardization. So as a colleague from the Australian standardization body once told me, is that someone somewhere has to pay.
Thank you. Indeed, this is the point, that standardization takes a big effort. Consensus building does not go for free. It's hard to work, and it requires to be financed, and therefore it is an important public investment that needs to be provided, because the common work is very important for that. It helps everybody. And Ms. Yinklin, would you take the question on how the WHO would be working in the future in relation to developing standards? Is there some possibility that there is a strong leadership in this regard?
Yes, there are several groups within WHO that are initiating rapid research studies to look at eventually triggering a kind of standardization process through the normal mechanisms. It's really more right now of a question of evidence-based gathering, doing the proper research studies. I will point to the preferred product characteristics for personal protective equipment that was published in 2018. This lists 10 criteria for the ideal PPE for healthcare PPE, especially. From those, we could envision that each of those loose characteristics could be tied to standards that measure how well the PPE of the future could meet the criteria necessary for healthcare-related PPE. So it's a long road. WHO takes on a research perspective and initiating or proposing research studies that hopefully will be taken on later once it's in the public domain by the standards organizations to then formalize that into a standard. It is a long road, so I can't say that there's anything in the short term that will give you that answer, but there's a lot of research that's taking place. Some of those projects are 3 months. They have a 3-month timeline. Several of them are proposed for 3 months. So this is very rapid research. And it's the time now to gather the evidence and really focus on PPE, what kind of PPE is being used in the field, what is protective for healthcare workers, and just making sure that those baby steps, those first steps are taken. So that's how I would respond.
Thank you. Thank you so much. And yes, I learned that we are over time. We need to bring it to an end. Still, I would like maybe Lorenza to give the floor, just to address the issue of training. You have been working on education. And then I will also turn directly to the end towards Dorina, who has also been working on our knowledge aspect of training. So, the floor is yours, Lorenza, please, Mike.
Thank you. I will just make a very short point. I appreciated very much all the discussion, and especially Marcel was pointing us to the need for capacity building. And I'd like to say it's not only capacity building about standards related to PPE, it's also capacity building more generally about how to face risks, how to manage continuity, how to manage emergency. Because if we don't have those basic competencies, then learning about how to make masks, how to wear masks is ever so important, but it only is going to take us part of the way. So thank you once more.
Thank you so much. And with this, I would like to give the floor back to Dorina to mention also something about training and the knowledge hub, and eventually to close. In the meantime, I would like to thank you so much. It was great having you around in this discussion. And as usual, when we start really getting into the subject, we need to close, but certainly we will continue making sure that we collaborate in the future. Thank you. Thank you.
Thank you very much, Bernardo. Indeed, please, we have a platform for online training, which is the TII Knowledge Hub. I mentioned the link before. It's tii.unido.org. There we do have some trainings which are self-paced and everybody can take upon their own availability. We are constantly working to expand our training offer. So we are very interested to hear also, resulting from these kind of discussions, what is the interest and which direction we should work in the future. In general, I would also like to thank everybody for a very successful participation. We got a lot of questions through the Q&A box. Thank you for all who posed the question. Thank you for the panelists who answered them. I'm sorry that we did not manage to answer all of the questions. We are always constrained by time, but we still hope it was a fruitful discussion for everybody. As promised, we will make the recordings available. Please again have a look at the tii.unido.org for more information during the next week. And having said that, I would like to officially close the session. Thank you everybody for having been here with us today, and we look forward to see you in one of our future webinars maybe. Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Bye.
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 Nice weekend.
Yes.
Nice weekend, yes.